Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Epidural and its absolute contraindications. So what does it include? It includes, first is the patient's refusal. So the patient will refuse. So it is a patient refusal. The second being the bleeding diathesis. So it will be the bleeding diathesis. Next is it involves a severe hypovolemia. So there will be severe hypovolemia. So there's patient refusal, there's bleeding diathesis, there's severe hypovolemia. Next is the raised HCT. So there will be a raise in the ICT, intracranial, and then there is also infection at the site. So there's infection which is seen at the site of injection. So these are the absolute contraindication. Lastly, in terms of the severe stenotic valvular heart disease. So in terms of the severe stenotic, so severe stenotic valvular heart disease. So severe stenotic valvular heart disease and also the fixed cardiac output states. The fixed cardiac output states. To learn and grow daily like this, please do subscribe.